what's clear is the science advice, the SAGE advice, the government advisors are saying that the measures that the government announced yesterday will not do the job of bringing down the rates of virus and will not get that R number to the satisfactory levels. In the Northwest, which I'm an MP for, we've seen the rates of infection go up, hospital admissions are going up, 143 deaths today. We've got to take that action now. We cannot sit on this, and that's why we've called for that, because that's what the science is saying we should do. And we've always said we should follow the science.
And that would be for the entire country?
That would be for the entire country, because, Ian, even though in some rates it's not as bad as, say, Greater Manchester, we're seeing that R number go up across the whole of England. So we've got to get a grip of it now. And that's what the science advice is saying, that we must do that. And part of this as well is not just about just having a 2 to 3 week break. It's about getting that test and trace system back up and running, because at the moment it's creaking, it's not working. And our local leaders are saying we need that localised tracing system because that's more accurate. It's got a 97% accuracy rate, whereas the national rate is 67%, so they must do that at the same time.
How do you explain to someone, say, in North Norfolk, where in the entirety of North Norfolk there are 19 COVID cases, how do you explain to businesses in Cromer or North Walsham or Fakenham that they would have to shut down when there's actually very little risk in that area?
Well, the way in which we explain it is because we'll give them the financial support and it will get the R number down and it will help. So as we go into the winter, instead of having this, crisis that's going to engulf England, if we don't take action now, which is what the science is telling us, it will help to get that, and it will help to get that test and trace system up and running, because rates are going up, even in those areas, all across England, rates are going up. And we've seen this in some areas where, they thought they had relatively low rates and then all of a sudden it's had a huge spike. So actually, we know from the science that we need to do something more than what the government has announced, and that's why we've took the step we have today. It's not something we wanted to do. It wasn't inevitable. It's because the government have lost control of the virus.
Now, correct me if I'm wrong, but I understand that the position paper that you put out this evening doesn't actually include any costings. So you're saying, well, we'd lock down and there would be financial recompense to different sectors, but you haven't costed it. And that's going to attract a lot of criticism, isn't it?
Well, Ian, yeah, and the reason why is because there's different variants, obviously, of how that costed, but the government took the action earlier with the lockdown. They took action to help businesses. If we don't do that now, businesses will go to the wall and we'll have unemployment, and we'll also have huge amounts of excess deaths. The economy will suffer already if we don't take action quickly enough. So that's why we're saying put that financial package in place to support businesses, support individuals, get that R number down and get those hospital rates down so that we can get control of the virus again, and that we can get a testing and tracing system in that's localised, that will help us track where that virus is. That will help the businesses. If we know where the virus is and we're not putting them in these measures that keep coming up every couple of weeks, they need some certainty and they need that support from the Chancellor.
Andy Carter, the MP for Warrington, a Conservative MP, he told me earlier that he was listening to John Ashworth, your Shadow Health spokesman, in the Commons today, and he said, I think it was about 3:00, a full national lockdown would be disastrous for society. And yet 2 hours later, that's exactly what your leader announced.
Well, I think actually, if you look at the science, if we don't do this, the science is saying that will be the scientists are saying that will be a disaster. The economic fallout of doing nothing now means that it's just delayed. Will be, what the government's been doing has been behind the curve all the time. It's like we're trying to play catch up all the time. The Prime Minister told us that the measures, like I'm a Greater Manchester MP, I've been in lockdown in Oldham for 10 weeks. It's not made a difference. And the science is saying unless we take more action now, it's not going to make the difference we want. And our businesses are already restricted. We're already restricted. I've not seen my granddaughter for months, and it's not making a difference. So we need this circuit breaker, because that's what the science is saying we need to get control of the virus.
Still can't believe you're a grandmother, but there we go.